I'm Dr. Leandro Fernandez, Director of the Laboratory of Advanced Sonography at Instituto Médico La Floresta in Caracas, Venezuela. And I will present the topic, three-dimensional ultrasound in small parts. Three-D ultrasound in the evaluation of small parts. Three-dimensional ultrasound is a relatively recent technique in clinical practice which is more frequently used in obstetrics and gynecology. But there is a wide range of current and potential applications in other medical specialties. There are different types of three-dimensional ultrasound: vascular 3D ultrasound, volumetric, surface mode, multiplanar ultrasound, niche mode, and vocal. Vocal stands for Virtual Organ Computed Aided Analysis. The volume acquisition can be done by using two different techniques: freehand or automatic acquisition. And the three-dimensional reconstruction can be done built-in, working in our equipment, or by using a workstation. This is a diagram representing the freehand three-dimensional acquisition. In this case, we sweep the transducer over the area that we want to study or assess, and then the computer constructs different planes, a different group of images, and then three-dimensional rendering is produced. By using automatic transducers, it's not necessary to move the transducer over the surface. You can set the transducer or place the transducer over the organ or this area that you want to assess for, and then the transducer automatically, by using electromechanic components, will make the three-dimensional acquisition. These are the sonographic planes you all know, the longitudinal, the transversal, and the coronal plane. And the advantage of three-dimensional ultrasound is that we can have at the same time on the same screen these three sonographic planes, obtaining this kind of image. This is an example of a three-dimensional ultrasound of a testis. And here we have the longitudinal, the transversal, and the coronal plane, and here we have the three-dimensional volumetric image. We will go back to this image later on. In this presentation, I will show you clinical examples of 3D ultrasound in thyroid, parathyroid, and testicle. Let's begin with thyroid. This is the normal 2D image of the thyroid with right lobe, left lobe, and the isthmus. And here we have a coronal view. This view is only obtained by using three-dimensional ultrasound. This is a coronal view constructed by the computer, where we can see here the left lobe, again the isthmus is the same patient, and also we can observe here the cartilage of the trachea. Again, this is the same image, and we can change the perspective by modifying our controls. This is a case of a subacute thyroiditis. By using extended field of view ultrasound, we can observe an enlarged gland, here the right, the left, and the isthmus. Here a close-up by using the zoom function of the zoom tool, and here the coronal view of the right, isthmus, and left lobe. This is the three-dimensional representation of the vascularization, an increased vascularization in this case. Another case of subacute thyroiditis. Here we can observe in this volumetric representation or presentation the altered echogenicity in transversal but also in longitudinal plane. Multinodular goiter. again with extended field of view ultrasound, the hypervascularization by using power Doppler, and here the three-dimensional reconstruction. We call this technique three-dimensional angiography. A complex cyst in thyroid also, with this solid nodular image inside the cyst, vascularized when power Doppler is used. The three-dimensional or multiplanar, in this case, the multiplanar rendering, and then the combination of surface and volumetric mode of the lesion. A follicular cyst observed with 2D, power Doppler, and then the multiplanar 3D ultrasound, again with the three planes, and then a combination of volumetric and surface mode. Thyroid adenoma with 2D and color Doppler, power Doppler, and here we can see how apparent is the vascularization is by using the three-dimensional reconstruction. This is the image obtained by only power Doppler, and this is the image obtained by using the 3D power Doppler. Conventional ultrasound of thyroid carcinoma, here these hypoechogenic with hyperechogenic areas in the junction of the isthmus with the right lobe, and here a volumetric representation or reconstruction where we can observe the longitudinal and the transversal plane. And the advantage to 3D ultrasound is that we can rotate the image in any direction, we can change the perspectives, and we can perform cuts in the image just looking for the extension of the lesion, or trying to define or trying to obtain a better definition of the limits of eventual tumor in this case. The same case now showing the vascularization, the increased vascularization with color Doppler, and here we have a 3D color Doppler. And we can do also digital subtractions of the B-mode image, and we can have only the vascularization three-dimensional representation. Parathyroid. Well, we start the study knowing, of course, the parathyroid localization. Sometimes it's difficult with 2D ultrasound to localize a normal parathyroid gland. In this case, this is the normal gland observed by using a 12 to 5 MHz transducer with extended field of view technique. Those are the sonographic characteristics of the parathyroid hyperplasia. Normally they are hypoechogenic or isoechogenic with a measurement of 5 to 10 millimeters in longitudinal view. Only few vessels are observed in these cases, and generally are multiple lesions. This is another case of parathyroid hyperplasia, and again another one with 9.7 millimeters. In this case, it's not hypoechogenic, but it is hyperechogenic. This is a parathyroid adenoma, so the measurement is higher than 10 millimeters, in this case 20 millimeters, by using conventional 2D ultrasound. Here the transversal view of the same case, and the power Doppler showing us the vascularization, and this is very important because we have here a nutritious vessel. It's quite important to determine the presence of these vessels, and this is an important information for the referral physician. And now this same case with a 3D reconstruction. First the multiplanar, and then we have the combination. This is a volumetric rendering, where we can observe an enlarged thyroid lobe with lesions inside the thyroid lobe, and we have at the same time the parathyroid adenoma. This volumetric image is always reconstructed or rendered by processing the multiplanar image first. This is another example of parathyroid adenoma. It's a huge lesion with the main nutritious vessels. And the same case, this is the three-dimensional reconstruction of the vascularization. With this technique, we can better determine the insertion of the vessels, which could be an important information for the surgeon. This patient was referred to our lab for a renal sonogram. We found these lesions here. This is a nephrocalcinosis. It was a bilateral nephrocalcinosis. So we decide to explore the neck of this patient, and we found this important and huge parathyroid adenoma corresponding to the same disease in this case. This is the adenoma showing the hypervascularized condition with power Doppler, and again compare, and we can see how apparent the vascularization is by using 3D ultrasound. The adenomas, the parathyroid adenomas also can be found in an ectopic position. In this case, we have a three-dimensional reconstruction. Here we have the subclavian artery. Here we have the carotid artery, and we have two structures here, two hypoechogenic structures. Here, this is one. Here, this is the second one, beside the main vessels of the neck, the subclavian, and here the carotid artery. We can rotate the image, and in this case, we can use this transducer of this image of the transducer in order to get oriented. And we can perform the cuts and these different slices in order to determine the extension of the lesions. Those are ectopic adenomas. Another example of 3D ultrasound, this is an image corresponding to the vocal technique, virtual organ computed aided analysis. This is a parathyroid adenoma of only 9 millimeters longitudinal measurement. And here we have the reconstruction, the volumetric reconstruction, and the computer offers an automatic calculation of the volume. This is a case of pleomorphic adenoma of the parotid gland. This is the usual image that we can obtain by using two-dimensional ultrasound. And this is the multiplanar image. And then we have here the volumetric image combined with the surface mount image. And then we can make the different slices or digital subtraction, and we can obtain this kind of image, and we can even navigate inside the lesion and calculate the volume of the lesion and the diverse components inside this tiny pleomorphic adenoma. Scrotal three-dimensional ultrasound. Well, those are the applications or clinical conditions that we can observe by using two-dimensional ultrasound. Testicular masses, hematomas, orchitis and epididymitis, varicocele, hydrocele. With three-dimensional ultrasound, we can obtain, we can study these conditions too, and we can obtain spatial view of these organ. This is a normal testicle presented by using 3D ultrasound. Longitudinal, this is the transversal, and the computer offers an immediate coronal virtual view. And this coronal view, we can rotate it, and this coronal view corresponds with the anatomical image that we all have studied in our anatomy textbooks. This is the epididymis here, this is the upper pole, the lower pole, this is the body of the testis. And this is the only way to have a coronal view is by using three-dimensional ultrasound. Another image, but now combining volumetric and surface mode. This is the scrotal surface, and this is again the testicle, normal testicle. This is upper pole, lower pole. This is anterior, and this is posterior. An example of an epididymal cyst, an anechoic image, and this is the multiplanar reconstruction, and then we have the combination of volumetric with surface mode inside. Orchitis and epididymitis, we can observe an altered echogenicity of the head of the epididymis here with an hypervascularized condition, better depicted when the three-dimensional power Doppler is used. Examples of epididymitis by using color Doppler, and this is a combination of B mode and power Doppler. Another example of orchitis with color Doppler and then with 3D power Doppler. An example of orchitis, hypervascularized, and then the three-dimensional reconstruction. Intratesticular trauma. It is an image corresponding to a intratesticular hematoma after a severe trauma. Very interesting because we don't have lesion here inside the epididymis, only intratesticular. This is a typical case of seminoma by using 2D ultrasound, and here 3D-dimensional ultrasound. We have some kind of box or some kind of paraffin block has used by the physician specialized in pathological anatomy. And here we can observe microcalcifications. We can perform different cuts or slices in the organ that we are studying, in this case testicle. We can do digital subtractions, and we can observe different planes by using this technology, in this case of seminoma. Multiplanar, here this is the coronal view, this is the right testis, this is the left testis. Here we have the volumetric representation, and we can see here the complex image corresponding to a benign testicular teratoma in a patient of 2 years old. Hydrocele, we are using here the liquid of the hydrocele as an acoustic window. This is the power Doppler, and here we have the multiplanar image. This is the same image I showed you before at the beginning of the lecture, but with the acoustic window we can even observe the surface of the testis, the surface of the organ. And this kind of image is only obtained by using three-dimensional ultrasound. With the use of 3D and 4D ultrasound, we can also perform needle guidance. We can do fine needle aspiration guided ultrasound functions. This is the tip of the needle, this is the tip of the needle, this is the lumen of the needle, and here this is an example by using 3D technology. and we are absolutely sure that our needle is placed on the proper site. Our group published this paper some years ago in 2004, and we try to determine if it's just a nice picture or can we use, is affordable, it can be done. And we work with more than 800 patients with an age of between 2 and 81 years old. And we use different technologies, automatic transducers, automatic technology, freehand technology, even workstations by using portable ultrasound, as you can see here. And always we use linear array broadband transducers from 12 to 5 megahertz and 13 to 5 megahertz. And our results were that we found a conspicuity of excellent and moderate of more than 95%, in fact 97%, 96%, and we obtained a poor image only in 3.8% of the patients. And the feasibility to perform 3D ultrasound in the small parts, it was a very easy study in 65% of the cases, easy in 32.8% of the cases, and only was difficult only in 2% of the cases. The reason is because the small parts are very stable, are not moving like a fetus. In a fetus it's more difficult because or different organs, the organs are moving with respiration, the fetus are moving him or herself. So in this case it's quite easy because the organs are statics. And the reproducibility of the method was 94.9%. 3D ultrasound in a small parts has disadvantages. The cost of the equipment. No measurements can be done when you use the freehand mode. The freehand mode can be done if we are using automatic transducers, but not in the freehand mode, unless you are using magnetic positioners. All the images I presented in these lectures, or most of the images, were done with a freehand technique. Of course, it's necessary a learning curve that at the beginning is time consuming. The three-dimensional approach rapidly digitalize conventional 2D ultrasound images, and not only blood flow but also the anatomy images. And 3D ultrasound rapidly reconstruct these 3D images and offers an interactive viewing of 3D imaging. And we can do needle guidance in 3D and 4D, permitting to do therapy planning. And 3D ultrasound offers a virtual coronal plane view. And a comprehensive image is obtained for the referral physician. It has advantages because we can obtain realistic images with high conspicuity, and we have the capability to work offline. So we can make volume storage, we can compare results and make follow-up, we can compare the previous ultrasound, 3D ultrasound, we can storage the image, we can do post-processing, and we can also transfer the data. And working offline, we have another advantage. When we are working with conventional ultrasound, it takes time to prepare the patient, 5 minutes, maybe 30 minutes to perform the ultrasound. If it's a sonographer is doing the test, he or she has to organize the data or the images in more or less 10 minutes, and then the radiologist that will review the images take more 10 minutes, so we can calculate 55 minutes to make a conventional ultrasound. Working offline, you can save time to the patient and save time to the lab because the same 5 minutes to prepare the patient, but you can obtain all the volumetric data in only 10 minutes or less. and the radiologist can go there and go through the multiplanar image and go through the volumetric images, and you can save up 20 minutes per patient. It was demonstrated in different studies and trials, and Dr. Beryl Benacerraf published a very interesting paper making the measurements of the time with the observation of the fetus, the volumetric images of fetuses. So in conclusion, three-dimensional ultrasound and three-dimensional reconstruction provides a very effective view of vessels, small structures, and internal surfaces. The assessment of the testicle, parotid, thyroid, and parathyroid gland is properly achieved by using 3D ultrasound. Non-OBGYN 3D ultrasound is a new and promising technique that opens a new vision in diagnostic ultrasonography, but absolutely further studies to determine efficacy, sensitivity, specificity, and accuracy of three-dimensional ultrasound in this field are still required. 3D ultrasound in the evaluation of small parts.